All right, we made it. Hello, I'm Dr. Horny Angus, and I want to welcome you to our webinar series, just for the health of it. And today, we're going to be talking about a really important subject, I think is an important subject, of debunking the fears of chiropractic care. And I want to welcome you to this live event, for those of you that are watching live, patients, non-patients alike, and for those of you that are watching on the replay, which you all have access to if you can't make it to this, or if you want to share it with somebody, there will be a replay of this webinar. So again, I want to thank you for being here, taking the time, probably about 30 to 40 minutes today, and hopefully you'll get some valuable information, and let's get started. So, I'm Dr. Horny Angus. I'm a wellness expert, wellness chiropractor. Been in practice for 39 years. And as it says here, that I help others, help people to understand being FAB, F-A-B, be flexible, aligned, and balanced. And as far as I'm concerned, being flexible, aligned, and balanced emotionally, physically, spiritually is the key to being healthy. So if you're flexible, loose, resilient, that adds to your health. Because what happens as we get older? We lose flexibility. Every one of us, whatever age we're at, as we're getting older, we get less flexible. We were more flexible 20 years ago than we are today. Alignment, balance, all keys. Number one problem in society today for seniors, epidemic, is falls. Out of balance, the body being out of balance. So when you're more balanced, more flexible, more aligned, you're fabulous, and that's what leads to health. As compared to in our society, we tend to really deal mostly with drugs and surgery to restore symptoms, reduce symptoms. So we're going to get into all of that. So we're going to talk about safety of chiropractic, cost effectiveness of chiropractic, the effectiveness and the value of what we do. So it's so important to share this information and let people know that there's nothing to be afraid of, especially for those of you that are patients of mine. You know that it's safe. You know that there's no risk, but certainly one has to be careful. You want to be an educated healthcare consumer so you make the right decisions for your health. And this is another tool or another option for your health. So I want to talk about the concerns and myths that people have about chiropractic care, the propaganda, and as I said, the safety, the cost effectiveness, and all of these other factors. So join me, thank you, and let's continue. So chiropractic care is a safe and cost-effective approach to optimal health. Let me show you. So first, here's a slide from Spine Journal. So I'm going to reference many journals of medical journals, not chiropractic journals, medical information that talks about how important and how effective chiropractic can be. Here's one about the safety. So this is likelihood of surgery for workers with back injuries. So if you went to see a chiropractor first with that back injury, you have a 1.5% chance of having surgery. It's pretty low. If you went to a medical doctor or a surgeon, you have a 42.7 chance of having surgery. What do you want? Talk about safety. Surgery should be a last resort. Therapy should always be first. Drugs and surgery. Actually, those are the only three options that we have when we have these types of problems. Therapy, drugs, or surgery. Your choice. Which one do you want to do? So the research has shown, see a chiropractor first, you have a better chance of not having surgery and having the problem corrected. And again, this was in Spine Journal. This is in the Journal of Manipulative and Physiological Therapeutics. And just a brief part of that, it says acute and chronic chiropractic patients experience better outcomes in pain, functional disability, and patient satisfaction. Clinically important differences in pain and disability improvement were found in these chronic chiropractic patients. So just to have some data behind us rather than the innuendo and misinformation that's out there, I think it's important. Now, facts are important, but feelings, emotions are even more important, how we feel, but certainly we need to establish some of this. In another journal, Annals of Internal Medicine, medical journal, and talks about, in our randomized controlled trial, we compared the effectiveness of manual therapy, which is what chiropractors do, by hands, manual therapy, physical therapy, and continued care by a general practitioner, medical doctor, in patients with non-specific neck pain. The success rate at 7 weeks was twice as high for the manual therapy group, what chiropractors do, as for the continued care group of the GP. Manual therapy even scored better than physical therapy on all outcome measures. Patients receiving the manual therapy had fewer absences from work than patients receiving either physical therapy or continued care by an MD. So again, it's a choice. What do you think is the right option for you? And here we have it documented in the Internal Medicine Annals. Here's a description of wellness chiropractic care versus medical care. Now, I'm a big believer and supporter of medical care. I just feel that there's sometimes the excesses of prescribing medications, the excesses of ordering tests. So we need medicine. We also need chiropractic, and we also need alternatives like acupuncture and massage and yoga and Pilates and meditation. Those are tools to help the body get well. But there are definitely distinct differences between what we do and what medical doctors do. So we deal with the cause, whereas the medical doctors deals with the symptoms. So do you want to suppress the symptoms, or do you want to treat the cause? What's the cause? We believe that you not being flexible, aligned, and balanced due to stresses in your life, physical, chemical, and emotional stresses, are what throw our bodies and our minds out of balance. And when we're thrown out of balance because the stresses of life, that's the source, that's the true cause of our problems. What are the stresses? There are physical stresses, there are chemical or nutritional stresses, and there are emotional stressors. All of them can wreak havoc with our body. And in previous webinars, we've talked about those in detail. And you can go back to those to see. We break down all the physical stresses, all of the chemical or nutritional stresses, and all of the emotional stressors, and how you can attack or deal or confront those so you can hopefully deal with the cause, the true cause, and the source of the problem, and therefore help to eliminate or reduce your pain without the use of drugs or surgery. So chiropractic wellness care is about expressing symptoms, about getting stuff out, versus the medication to suppress the symptom. Just in life, would you rather express yourself, say in a relationship, or would you rather suppress how you feel? Which is the healthier option? So you get to decide, do I want to suppress everything, or I need to express it? It's more work to express it, but it's certainly well worth it. Then we have 3 phases of care for wellness chiropractic care: is relief, correction, and wellness. And people get to decide. I just want relief care from this type of therapy, or we want correction or stabilization of the spine and the musculature and the joints and the discs, or wellness care over a longer period of time, or preventative care, as compared to just pain relief with medication that actually has many, many potential side effects. If you watch TV and you hear all these commercials from the big pharma and what those side effects are, I wonder why anybody would want to take those. But they do say those are the potential side effects, and you've got to be really careful. I believe that God didn't make our bodies to need medicines, but many people feel they do. So just be aware, if you are taking those medicines, that you are aware of the side effects. Then we have on the right side medical care, ordering lots of diagnostic tests, and there are many tests that are necessary, absolutely necessary. But again, as I said, it's the excessiveness of ordering tests. On this side, we have what's called choosing wisely, which we'll talk about in the next slide. And that means choosing wisely with regard to what tests does a patient really need? What do you really need? What's necessary? What's unnecessary? And my association combined in an initiative with the American Board of Internal Medicine to create what should or shouldn't be done. And we'll talk about that in just a moment. And then on the right again, relying on pills to do everything for you, every condition, every symptom, which again are on all the ads, whatever symptom you have, whatever label they've created of ADD, ADHD, you can't sleep, you're overweight, whatever it might be, there's a drug for it. Be aware of that, okay? Versus nutrition, learning how to manage stress, dealing with your posture, exercise, spinal manipulation, emotional state. What your emotional state, your mindset is, plays a big role in your overall health. So it's a very different perspective, but it's an option that people have. And again, it's documented that it's effective and it helps people. Just enough people don't know about it. As a matter of fact, 10%, when I started in practice 39 years ago, 10% of the population saw chiropractors. 39 years later, you know what percentage of people see chiropractors? 10%. Hasn't changed. And there are some numbers that say it's even less. 10% don't see medical doctors, 10% don't see dentists, almost 100% do. Where's the chasm? What's going on that's creating that? And that's what we're going to talk about, the fears and the concerns and the innuendo and the misinformation that's out there about what we do as chiropractors. I love what I do as a chiropractor. I've been doing it such a long time. It's my passion. It's my calling. But yet, so many people don't understand it. And again, this important webinar hopefully will clarify that for you, at least more so. So this Choosing Wisely, this initiative, as I said, is really about encouraging conversations between patients and their doctors about what care, what treatments, what procedures are necessary and appropriate. So they came up with five important ones that are really important to be aware of as practitioners to relate to patients. The first one, in the absence of red flags, do not obtain spinal imaging, x-rays, MRIs for patients with acute lower back pain during the 6 weeks after the onset of pain. So many years ago when I started, somebody had pain, I immediately x-rayed them. And they're saying, don't do that, wait 6 weeks. Why are they saying that? Because the premise of the work that we do is that the body has an amazing ability to heal. It heals. If you have a cold, a bad cold, if you rest and you get enough sleep and you eat well, your body heals. If you have a cut on your arm, your body heals from within. So it's a matter, if you have a broken bone even, if it's a hairline fracture, nothing major, the body heals on its own without surgery being necessary. And that's what they're saying here. Give the body a chance. So like I said in the past, I get x-rays. Now we talk about x-rays, talk about MRIs, but as long as we see a patient improve over those first number of weeks, there's no need for x-rays or MRIs. Person doesn't improve, then we've got to find out why. And those diagnostic tests are important. Number two is don't perform repeat spinal imaging to monitor. So continually taking all of these tests to see what's going on. They're saying it's not necessary. Number three, avoid prolonged or ongoing use of passive or palliative physical therapy treatments for lower back unless they support the goals of an active treatment plan. So what's the treatment plan? Is it wellness care? Is it maintenance care? Is it corrective care? Understanding that is really important. Number four, don't provide long-term pain management without psychosocial screening or assessment for possible related psychological disorders, most notably depression and anxiety. And I call this the mind-body. I believe 90% of the people that come to me with back pain, they tell me they didn't do anything. How could they be having back pain or neck pain or shoulder pain or headaches? They didn't do anything because it's not physical. 90% is emotional. 10% are from actual falls, traumas, being overweight, physical stress that creates problems. So it's really important to understand the emotional component. What's going on in your life emotionally, relationship-wise, financial-wise, work or school-wise, time management-wise. Those are emotional issues that have to be dealt with. As I talked about earlier, the true cause. That's the true cause of many of our problems, physical problems that occur, if one wants to accept that and believe that. And then number five, do not prescribe lumbar supports or braces for the long-term treatment or prevention of lower back pain. Why is that? So supports temporarily, like medication, might provide some relief, but they actually don't allow your body, your muscles, your spine, your joints to work properly. It creates the support temporarily, but it doesn't give your body that mobility that we need. As I said earlier, we lose mobility. So actually it creates atrophy and mobility by relying on these braces and crutches and supports. After all these years of practice, I don't ever recommend that. Medical doctors do, different approach. But I'm trying to give you a different perspective, a different paradigm as to what we do. Doesn't make it wrong, doesn't make it right. It's just a matter of a different approach. So when my kids, even when they were playing sports and they had a fracture, we'd go to the hospital, we'd get an x-ray, normal medical approach. Then they say he has a hairline fracture. And we'd say, okay, he has a hairline fracture. We could just kind of wrap that up. And they go, no, he needs a cast. I go, no, it doesn't. The body heals on its own. The body's going to heal. And usually 4 weeks later, there's not only no atrophy, we've increased mobility into those joints, into those areas where the break was, and it totally heals because healing comes from within. It doesn't come from the outside. And again, we'll talk about that further. So here, chiropractic care is a healthcare profession that focuses on what? The disorders of the neuromusculoskeletal system. What is that? The nerves, muscular, skeletal, bones, spine, ribs, joints, neuromusculoskeletal system, the effects of these disorders on general health. And here's some of the conditions that we treat. These conditions are also treated by medical doctors. With what? With drugs and surgery. Every one of these could be treated with drugs and surgery. But we treat them manually. As I said, chiropractic is a manual therapy. So the word chiropractic even means, practic means practice by, chiros means by hand, practice by hand. So we manually work on each of these areas. And if you have any questions about any of these conditions, I'd be happy to discuss with you how these are treated manually and with wellness chiropractic care. But these are all treated with drugs, as I said. You've got that option. You've got that choice. How do you want to approach it? Okay? Now we talk about iatrogenic disease. Talk about safety. So iatrogenic disease, I hope some of you have heard this term. Probably most of you haven't. Iatrogenic disease is drug or physician-induced, physician or medication-induced, and as a result of diagnostic and therapeutic procedures undertaken on a patient. So it's drug or physician-induced, where there's some kind of drug or some kind of procedure that creates a disease, actually creates deaths. And these are all documented in the medical annals, in the medical journals. On the bottom it says, factoid, the total number of iatrogenic deaths per year, 783,000. So almost 784,000. That's over 2,000 deaths a day from this. And iatrogenic, I'll read this to you. Iatrogenic disease can be caused by any number of medical oversights or mistakes. They may occur during a hospital stay or a routine doctor's visit, and there is no single cause, medical condition, or circumstance linked to these occurrences. Iatrogenic events may lead to physical, mental, or emotional problems, or in some cases, 784,000 of them, even death. A few examples to give you a clearer picture of what iatrogenic disease is. If you were to become infected because a doctor or nurse didn't wash their hands touching a previous patient, that's considered an iatrogenic infection. If you had surgery and the wrong kidney was removed, the wrong knee was replaced, that's iatrogenic disease. And if you were given a prescription for medications that are well known to interact with each other, but you weren't informed of those risks of those interactions, an adverse outcome would be considered this iatrogenic disease. So the synergistic effect of drugs, not only with each other. So one drug with your body chemistry reacts differently than the exact same drug with another person's chemistry. Then you add a second drug or a third or a fourth drug, and how that reacts with your chemistry is different than anybody else's, and the effects can be quite dangerous. And that's part of what iatrogenic disease is about. So safety, I'd much rather have, personally, therapy than drugs or surgery. But that's, again, a choice that we all have to make. This is from the Journal of Manipulative and Physiological Therapeutics. And it says that lower back pain initiated, as we talked about earlier, if it went to a chiropractor first, much less chance of surgery. Lower back pain initiated with a doctor of chiropractic, a DC, saves 40% on healthcare costs when compared with care initiated through an MD, according to a study that analyzed data from 85,000 Blue Cross Blue Shield beneficiaries in Tennessee over a 2-year span. Researchers estimated that allowing the DC-initiated episodes of care first initially would have resulted in an annual cost savings of $2.3 million for Blue Cross Blue Shield. The authors conclude that insurance companies that restrict access to chiropractic care for lower back pain treatment may inadvertently pay more for care than if they remove those restrictions. So that's, again, the politics of what goes on with insurances, and that's one of the challenges people have. One of the fears is with insurance, coverage, no coverage. So we're going to talk about that, all right? Seeing a chiropractor first. Most people see me last. They go to the medical doctor first and do whatever they do. And then if that doesn't work, then they come to see the chiropractor. So if we could change that around, that people could see the chiropractor first, that could be obviously much more cost effective and result driven also. So chiropractic care is a covered benefit in some insurance, in some policies. So there are some people that come to me. Used to be everybody was covered years ago. That's changing over the years. Now probably 40% of my practice are people that have coverage with insurance, and 60% pay out of their pocket. And that's where people have to make a decision, whether they want to pay for it. Do they want to have a third party decide what they do, an insurance company, to base their health on? Or do they want to understand the value of really good health care to be healthy and to understand all the ins and outs of what it takes, not just covering up a symptom? That's what we talk about, the cost versus an investment. What's the cost of going to a doctor? Is it an investment? Are you investing in your health, or is it just costing you out of pocket? If you look at it that it just costs you out of pocket, then you're probably not going to do it because it's costing me money. If you look at it as an investment in your health and understand the value and it is valuable to you, then that's something you need to pursue, because we have to invest. Even we buy water, bottled water. We invest in ourselves in joining a health club. We buy organic foods. People come to chiropractors and acupuncturists and pay out of pocket. So the masses don't do that. Most people say, whatever my insurance covers, that's what I'll do. And that's just a way that a person thinks. And everybody's entitled to their own beliefs. So your beliefs create your reality. So if you believe the insurance company is what dictates your care, that's your right. If you believe that it doesn't, then obviously that's your right too. Okay? So I can go on and on. A lot of resources about this, about chiropractic being safe and effective. And just one caveat emptor, let the buyer beware. Safety of chiropractic, and although chiropractic does have an excellent record, no health treatment is completely free of potential adverse effects. Patients after treatment can feel relief, but some may experience mild soreness, stiffness, or aching, just as they do after exercise. So when we work on somebody's muscles and their spine, we're creating mobility, motion, flexibility. You might feel some soreness after that. It's not a bad thing. It's actually a sign that the body needs to be moved and manipulated and realigned, rather than, oh my God, I feel something. A lot of people say, oh, I feel this and I feel that. And it's okay to feel. Our body has feelings there's a signals to tell us something's wrong. Just like in the dashboard of a car, if the red light comes on, you could either ignore that red light and probably keep driving for a while. But if you keep ignoring that red light, what's going to happen? That car is going to stall at some point and die on you. Versus, you know what, there's a red light. I think I better do something about it. And at that point, when there's that signal, whether there's symptoms or whatever it might be that you don't feel right, your energy's low, different symptoms that might occur in your body, digestive issues, then what do you do when you feel and see that signal? Do you just take a pill to cover it up? Or do you assess that maybe my body's out of balance? Maybe my body's not functioning, not working the way it should. So it's really understanding how to assess your own body, being in touch. I have a saying, if you don't go within, you go without. So you have to look within yourself to see what's going on with my body. What do I think I need? So that's where caveat emptor, let the buyer beware. You be aware of your own body. Nobody else cares more about your body than you. And here's some numbers of putting neck pain treatment risks into perspective. So on the left side, out of 1 million people, 1,800 have an overall risk of death from spine surgery. 1,800 out of 1 million. Then the numbers go down. The risk of serious side effects from cervical spine injury is only 500 per 1 million people. Then the risk of death from combined use of NSAIDs, non-steroidal anti-inflammatory drugs, or aspirin, is only 153 per million people. The risk of death from aspirin alone is 25 per 1 million. And then the association between neck manipulation and stroke is less than 1 person per million. So there's a big fear out there with strokes. Chiropractors cause strokes. But that's not true. Chiropractors don't. You can get a stroke by going and getting your hair done and sitting in one of those sinks. If there's a weakness in through that area, it can occur in any office, any doctor's office, and the statistics certainly bear that out. And here we have some of the odds. The odds of having a stroke in a normal population when seeing a chiropractor or an osteopath, osteopaths do manipulation also, is 1 in 5,826,000. 1 in 5 million, almost 6 million people. The odds of dying in an airplane crash, 1 in 205,000. The odds of dying in a car accident, 1 in 18,000. The odds of dying when ingesting aspirin are 1 in 3,000. The odds of fatally slipping in the shower are 1 in 2,200 people. So as you can see, the propaganda is out there, but yet there's lots of fears. Oh, why don't I go to a chiropractor? They cause strokes. I'm afraid of the adjustment, the manipulation of the spine, costs too much, the insurance doesn't cover it. There's so many fears that people do have. And this just helps to document that there should be no fear. Here's some other, from Consumer Reports, 95% of past year chiropractors say that it's effective. 97% of past year chiropractic users are likely to see a doctor of chiropractic if they have neck or back pain. 89% of past year chiropractic users recommend it to family and friends. And 88% of past year chiropractic patients agree the quality of care received was a good value for the money. So it's a matter of people do experience great results, but we just only have that 10% of the population. We have a small percentage. How can we expand to expose more people to that? And again, that's what a webinar like this is about, really trying to help expose people to not have those fears. And again, I invite people, any questions you have about any of this, happy to talk to you in detail and in depth about it to ease any of those fears. With all this positive data from my patients, scientific studies, why are so many afraid to try chiropractic over a quick fix pill? It's easier to take a quick fix pill, isn't it? It's cheaper. You just pop the pill. But what are the side effects? What are the side effects of those drugs? So we're in a quick fix society. We don't have patience. I ask patients, can you be patient for this problem that might take a little bit of time? And most people don't have the patience for that. But things in life that are worthwhile and worth living take time. Having a great career, job takes time. Getting healthy takes time. Building a good relationship takes time. Things take time versus, oh, I want the quick fix. I want that quick answer. And I understand that. But it's, again, it always comes back to your own individual choices. And we all have our own beliefs, as I said. So whatever your beliefs are, your reality, different than everybody else's. So I would argue that it is our personal responsibility to take care of our own health, not for our health to be taken care of by a third party. Whether the third party is an insurance company, whether the third party is a doctor, whether the third party is any outside influence. It's your personal responsibility. How accountable are you? How accountable will you be to take care of your health? And that's the hard part. What I've learned after all these years is that helping people feel better is kind of the easy part. But that's frustrating because my goal isn't just to help people feel better. It's helping people to change their lifestyles in the long run. So if you eat better, you sleep better, you exercise more, you have better posture, and you have a better mindset, those 5 keys, that's what I believe leads to good health. It doesn't cost you a dime. It doesn't cost you any money. But those are the keys to good health. And there I go on. That's the crux of the problem. We want others to take care of us and restore what our own bad lifestyle choices and habits have created. So how important is that? It's really important to see that means so much. We have to be accountable. It's hard to be accountable. That's the most probably common 4-letter word I hear. It's hard. Everything's hard. It is. Life is hard. Work is hard. Being healthy is hard. Building relationships are hard. Everything is hard. To me, that's just an excuse. It's hard. What do you do about it? What's the action step? Okay? So there's some fear-based opinions about chiropractic. So there are bad apples, there's propaganda, there's lack of knowledge. So let's go into those 3. So one bad apple can really spoil the whole bunch. And these unfortunate scenarios that can occur. X-rays, regarding X-rays and tests. And we talked before about this. I went for an adjustment, was forced to have X-rays, and strange tests. My insurance was charged $3,000 for something I didn't really need. So you don't want to have that. You don't want to just, the x-rays. We talked about choices before. You have a choice in that. Bait and switch. I called and I was told I was totally covered. After my appointment, the person at the front desk said they didn't take my insurance and I was forced to pay $200. They had the nerve to tell me to come back 3 more times. So you don't want to be, everything should be transparent. Everything should be open. So you are totally clear about what you're receiving. So you have to be an educated healthcare consumer in this process of whatever doctor you go to. And then package deals. After my first visit, Dr. Blah told me that I would need to come in 3 times a week for 6 months. How does he know that they need 6 months? He offered me a discounted price only if I paid everything up front. If I felt better I did feel better after 1 month of treatment and couldn't get my money back for the rest of the months I didn't need. So how does anybody know? And it should be month to month. So it might take a few weeks. I have no problem with that to heal, to get the body to function at a higher level, but it has to be reassessed periodically. And we were trained as chiropractors, treat people for 3 months or 6 months. I treat people for years, but it's on a maintenance or a wellness basis, and it's much less frequently. It's a matter of understanding what you feel you need, communicating, open lines of communication with whatever doctor is recommending, whatever drugs, whatever tests, whatever treatments are necessary. So hear more about the propaganda, misleading information spread by people who have strong biases against the practice, chiropractic, they know nothing about. And a lot of people, 90%, have never been. So 90% of people don't know anything. Doctors don't know what we do. People that come to us understand what we do. That's why people that come to us recommend people that they work with or love or family, whatever it might be, to recommend those people to come in because they understand what's done, that it's safe, that it's effective, that there's value, okay? But what's out there, the propaganda out there, can be dangerous and quite misleading. And the first thing you see when you fly above the propaganda and gain factual perspective is that your dollars are not spent on health care. They're actually spent on sick care. You're spending money on sick care. We believe in health care. We want you to be healthy, not sick care, not having a symptom, by not living in the right lifestyle, having these symptoms, and then just putting the fire out by removing an organ or suppressing it. Okay, sometimes it's too late and those things have to be done. But we're talking about being proactive, being preventative, okay? So big pharma, how much money is spent by big pharma on TV, on commercials, on magazine ads, all over. Billions and billions and billions of dollars that they spend on that. Versus how many ads do you see for alternative approaches like chiropractic, acupuncture, massage, yoga, Pilates, meditation? I don't see very much about that. Whether that's our fault or our associations, but to compete against the medical community with all of that, very difficult. So that's what many people decide to do, okay? Chiropractic approach is not about masking the pain, as I've said, but preventing pain from happening in the first place. By what? By being fat, flexible, aligned, and balanced, emotionally, spiritually, and physically. Preventative health is all about your choices. A few bullet points. Chiropractors aren't real doctors. It's false. As you can see, those certifications in my office, I'm fully trained, accredited doctor of chiropractic. So, DC, I'm a doctor of chiropractic. An MD is a medical doctor. A DDS is a dentist. A DO is an osteopath. An OD is an optometrist. A DPM is a podiatrist. All different types of doctors, all have different criteria for what they do. So I'm not a medical doctor. I don't prescribe. I don't do surgery. But I do all the other things that we've talked about from a manual, natural perspective to allow the body to function the way it's supposed to function without the use of drugs and surgery. Propaganda will give you a stroke. We talked about that previously with all the statistics. My medical doctor says it's much better to see a PT over a chiropractor. They refer to PTs. They don't generally refer to chiropractors. Just different game. Physical therapy is more under the medical model as compared to the wellness model, okay? And chiropractors only treat back pain, which is not true. We treat many types of conditions. Yes, chiropractors treat back pain, but your spine is one of the most important parts of your body. It gives your body structure and support. Your spine controls everything. Your spine, your nervous system, me moving my fingers is controlled by my spine and my nervous system. Your heart beating on its own, involuntarily, is controlled by your spine and nervous system. Your stomach, your digestive system, producing enzymes to break down the food you need, is all controlled by your nervous system. Everything is controlled by your spine, the mobility of your spine, and how your nervous system functions. So we have what's up with the cracking. It's, oh, chiropractors, they crack your back. So let's kind of talk about that a little bit. So here's the safety pin cycle. So on the left side that's an enclosed cycle. So that's good flow, good energy. Everything's in alignment there. Everything's functioning. There's ease there. The open pin is where there's dysfunction, where there's what's called a misalignment, a subluxation of the vertebrae that needs to be realigned to create the cycle that's flowing, that's connected as compared to disconnected. So we have ease on the left, dis-ease on the right. And that's where adjustments and manual therapies to restore flexibility, alignment, and balance create this harmony, this balance where the nerves carry the messages between your brain and your body. So adjustments are one part of that. Dr. Roger Sperry won the Nobel Peace Prize. He said that the spine is the motor that drives the brain. He also said that 90% of the stimulation and nutrition to the brain is generated by movement of the spine. So now if your spine isn't moving properly, because you've never been adjusted, you've never had body work on the musculature, there's no way you have movement in your spine, which is what we need. And he's saying 90% of that is generated by movement of the spine. He also says that only 10% of our brain's energy goes to thinking, metabolism, immunity, and healing. You think more of it, but 90% goes into processing and maintaining the body's relationship with gravity. And that's called balance. And we lose balance because as we get older, we become, as I said, more rigid. So if the wind blows and there's a tall oak tree that's rigid, what does the wind do? It breaks the tree. If there's a reed in the wind, it bends. How can we be more flexible? What tools are you using to be more flexible in your spine? With kids have a fall. They fall, what happens? They get right back up. They're resilient, they're flexible. A senior, an elderly person has a fall, what happens? Could be ultimately death. Could be a problem from that point on in their lives. And as I said earlier, the number one epidemic in seniors is falls. And that's due to this balance issue, due to the lack of mobility of the spine, the misalignment of the spine. It's so important information, such important information, but yet it's not out there. It's misunderstood. And again, I hope this helps to clarify. Chiropractic adjustment. Chiropractic adjustment or manipulation is a manual by hands procedure that applies a force, sometimes mild, really gentle, low pressure. Again, any questions, I can show you how gentle it is. Sometimes firmer, directed to one or more dysfunctional, low mobile, non-moving joint segments. And it's a procedure that requires highly refined skills, that's what my license is for, developed during the doctor's intensive years of chiropractic education. The adjusted procedures and techniques are precise, controlled, and designed to introduce mobility into a dysfunctional joint. Patient is positioned on a specifically designed adjusting table, chair, or other specialized equipment. We use our hands or an instrument even to then skillfully apply controlled force, directing motion to the joints of the body in order to restore proper alignment and movement within normal ranges of motion. So just like people start losing, as I said, as they get older, losing that mobility, that's what this is about. Between the manual therapy, the trigger point, and we focus on three components. The adjustment is one, physiotherapy like heat, such as electrical muscle or nerve stimulation, okay? And the manual trigger point therapy to get into the muscles and release the tension in the muscles from head to toe, from the bottom of the feet to the legs, to the head, to the jaw. All of those muscles get tighter as we get older. And these types of adjustments help to restore that. So, some quotes to leave you with. Be the type of person to leave a mark, not a scar. Okay? Leave a mark in your life. I always told my kids growing up, I said, you have three options in your life. You can have a job, which is nice to have a job. You can have a career, which is even better, or you can have a calling. What's your calling? So today's webinar, I talk about all kinds of symptoms all the time and conditions. This is the first time in 39 years that I've talked about something this important, to be transparent about all the fears that people have. And I know this one webinar is not going to change the world, but certainly I hope that some people see it and say, you know, maybe I'll be that 11% or 12% of coming towards alternative approaches, whether it's chiropractic, acupuncture, any of these that really help your body to work properly. So leave a mark, not a scar. Anything that costs you your peace is too expensive. So my first webinar in this series was about finding your calm. And I think that's one of the most important parts of health and wellness is inner peace, calm, tranquility. That creates balance versus the opposite of that, which is turbulence. Have all this turbulence in our lives. So anything that costs you your peace is way too expensive. So find what costs you your peace. I can help you with that. If you have any questions about that, there's simple ways. Actually, one of the most simple ways, which we'll talk about in a second, is live your life without pretending. Don't pretend. Be real. Be genuine. Don't be afraid. Take risks, okay? Don't pretend. Love without depending. The most important relationship you can have is with who? With yourself. So love yourself. Love without depending. Depend on others. We need others in our lives. All of us do. We need that support. But love without depending. Listen without defending. Be non-judgmental, non-critical. Just listen. Hear what people have to say. Be open to it without defending it, especially if you don't know anything about it, which many people do. They are critical and judgmental of things they don't know anything about. And then speak without offending. And that's coming from the inner peace that I talked about, number 2. Speak without offending means coming from a place of loving, being more loving, more caring, more giving, and more kind. And we can all work on that. No matter who we are, no matter how loving, caring, giving, and kind we are, I think we could always raise the bar. And that's something I work on myself every day. And there's always room for improvement there. But I think if you're loving, caring, giving, and kind, it creates that inner peace, which creates flexibility, alignment, and balance spiritually, which leads to better health. So love life. I want to thank you again for joining me on this. And there'll be more webinars coming in the future. And starting the new year, I wish you a very happy holiday season, a happy and a healthy new year. That's where you can find me. Thank you very much. Have a wonderful day, and God bless. Bye-bye.